Here we are back on a holiday week. If you're listening to this when it drops, welcome, Renee. What are we talking about today?
Oh man, we're going to be talking about drug use in the workplace, which doesn't sound like the most positive thing to be chatting about for holiday week, but so important given
Well,
the holidays are here. So
I
we're going to be talking about
remember
it.
when we used to talk about when do people drink the most?
Oh, right. We used to have that terrible slide that had like the turkey on it, wasn't it? Like
Yeah,
a turkey.
it
And
was.
it was in November. And isn't Thanksgiving one of the highest of all of them, right?
Yep. And
Pretty
so
sure.
after Thanksgiving, everyone goes back to work.
Oh, yes, that Black Friday.
Yep.
It's called Blackout Friday,
Right,
I
it
think.
is.
Oh
Um,
yeah, I'm
and
remembering that
so
terrible slide from way
so
back when.
this all ties together because
All
it
ties.
impacts the workplace. And
It
so
does. It does.
that's our conversation today.
But what's
Speaking of,
happening on the farm before we get there today?
it's cleaning up. It's cleaning out the dryers.
Ugh.
It's getting all the dust and junk out of everything. It's cold.
Yeah.
Trying to just get everything cleaned up and buttoned down for the winter. And so it's nice to be done with everything, but you're never done on the farm. That's the problem because there's always all the stuff to fix that I broke during harvest. And so there's a whole winter of stuff to fix because a whole lot of stuff broke when we were going all night long a couple
Yeah.
days. So
I know,
there's
but
that.
if you didn't have anything to do in the winter, you'd be so bored because you can't sit still
I
for five
know.
seconds. So it gives you something to do and it gives you reason to go back to the farm, right? Be
Yeah,
like,
absolutely.
gotta head back out there. So to kick this off, we're going to talk about some of the problems related to substance abuse and then we're going to really dive into the data on like how it impacts the workplace because all of us, especially through the holidays, people sometimes imbibe more than they should normally in different substances and it leaks back into the office. And so let's talk about that. So what are some of those problems that we see when you don't really address this in your workplace?
Yeah, I mean, I think we've all been to a certain amount of trainings on this area, and we all know the gigantic numbers we'll talk about when we get to data of what it costs the economy every year in that lack of productivity that occurs because of substance use. Poor decision making, the distractedness, theft, poor morale, high staff turnover. I mean, the list goes on and on and on. And sometimes we underestimate the impact or we don't understand or recognize the underlying substance use issue that may be co-occurring with what's going on in the workplace.
Right. And so we think about like who's impacted by this. So I always think about this from multiple directions, and we'll talk more about it in a little bit. But, staff turnover comes in not just because of the person using substances. It can, those types of things, and morale is not just the person using substances. So if you don't have wisdom on how to deal with this issue, many people in your office can be impacted. And we'll talk more about that moving forward. So when we think about this, it's sometimes we're like, oh, well, I'm not the person using substances at work, so it doesn't impact me. But if you're in leadership and you're not addressing it, you are impacting a lot of people, especially people that may be, irritated about how things are going down. And then there's rules and laws about how you have to help people, which is
Mhm.
good. We don't want people just kicked out of work because they have an addiction, but those laws protect people. And sometimes that protection depends on what side you're on, can go too far, can be enabling in some ways.
Mhm.
And so it's a sticky conversation. So me and HR are tight when it comes to this because there's rules, right? You can really screw this up. So I think about just off the top of if I know somebody at work and I've got concerns that they have a use problem, and I now work in government. I have to be careful. I can't just walk up to
Mhm.
them as a concerned person and say, "Hey, are you okay?" with an intent to talk to them about substance use because you can literally get in lots of trouble. And so it's like it's hard because it's what I'm trained in like mental health first aid
Mhm.
to do and what I can do legally at work because of my position don't always align. And so this is not an easy conversation. You hear about it a lot, but I don't think people think through some of the ramifications of it. And so, you've got, do I just don't say anything and just let them continue using and destroy their life, which is not how the kind of person I am. But at the same time, where's the legal line in what you can say or how it goes about it and all of that. So this is really, really hard. And so that's where that stuff about poor morale and turnover comes in. And, and then the drugs and then types of drugs now are becoming harder to understand and then even be able to test for.
Right. I think that's a huge thing. So I think about the impact on teams because usually there's folks who are having to take up the slack for the
Mm,
person who's not performing. And sometimes, a lot of times, other people know what's going on. And it's just a struggle to figure out how to follow policy, right? How to follow those policies and procedures to protect yourself. And so I think those things are challenges. And at the end of the day, so many substances aren't even detectable, right? You look at
mhm.
a standard, 8 panel or whatever panel probably you get when you go to the physician, when you go to that workforce clinic, when you take someone in to be tested. There's so many derivatives out there that aren't going to be picked up on that panel. I was just at a presentation here a few weeks ago, and I was reminded of how many substances aren't going to be picked up. And
Oh,
so, I think that makes it harder also for employers who really want to do the right thing, who want to help connect someone to support, because that's what's best for the whole team. It's what's best for the organization. But sometimes those tests aren't going to show that there's any impairment, although the person is very impaired. And so that then is a tool that makes it a lot more difficult sometimes to navigate through when it comes to accountability and helping link someone to resources, especially if they don't want those resources.
right. And we're trying to talk here about illegal substances, but that, or maybe substances that are legal. But you also, I mean, I remember it wasn't that long ago that had a cold and I was taking cold medicine and I woke up super loopy and
Uh-huh.
I don't know if I took too much. I'm not totally sure what happened, but I couldn't go to work that day. I couldn't think straight.
Mhm.
And, that's a reaction. That is a substance. It is a safety, potentially a safety issue, and it was over the counter medications. And so it gets very murky when you're trying to help people and they may just be either not taking the right medications, or I know I had an employee that I'm pretty sure had a drug um, reaction to medications that were prescribed for them, so they would nod off during work
Mhm.
days and during work hours. And I'm pretty sure it was the prescribed medications, but it was a side effect of prescribed
Mhm.
medications. And so they weren't able to be on their best game and to really do the job. And so, medication in general, even like all of these types of substances, it's a big picture conversation. And we, I'm laughing. A little while back, we did that episode on vaping and ticked some people off, Jason. I don't know if you heard, but
We got a bunch of comments, Renee, which I was ecstatic to see all the comments.
yep, we had some comments because what we were saying was that the bigger picture, this is this conversation about drugs and not being detectable. We don't totally know what's going to happen with all what's going on in the vape products. And this person was trying to argue that it was safe and that people have said it's safe. But the word safer, as you and I know, could be 1% different from something else, and then it's safer. And we don't necessarily mean that it's safe or good for you. Good for you is very different than, quote, safer than something terrible. So this is the same thing, right? It's like, people should be on their medications, their prescription medications, but you can have reactions and it can happen in the workplace. And so,
Any drug can be abused, right? Any drug can have negative side effects. And when we
yeah.
talk about it impacting the workplace, that can be anything. Even something taken for a legitimate purpose can have a negative impact in the workplace. And I think that it's important that A, you know your policies in your workplace, but you have a plan to address those things when they come
Yeah.
up, because it's going to come up much more than you think it's going to be. This is one of the number one issues in
Yeah.
workplaces across the country today.
One more thing, just because we talked about Narcan a couple episodes back, and it was a training. I won't say where, but everybody got trained on how to use it. So everybody had it like in their purse. And a lady and a friend were outside, and the lady wasn't feeling well and whatever. So they Narcaned her. She was having a heart attack.
That's not a time to use Narcan.
But apparently the trainer
Yeah,
says you never can tell
well,
what the
it's
signs
true.
and signs and symptoms are. So this poor person was having a heart attack and got Narcan, and the whole story just makes me giggle because I'm like, bless their hearts. They were trying to do the right thing.
Well,
They'd gone to training and they're like, you never know when somebody needs it. So they did it out of an abundance of caution. Hopefully it
what
didn't.
It
harm
doesn't
the.
hurt anything. It doesn't hurt anything. You can give Narcan or any of the newer
That's right.
drugs, and so it
That's
doesn't
right.
do any harm. But I think it does go back to a lack of understanding of
Yes.
pharmaceuticals in general. And there does need to be more workplace training. I'm a
Yes.
big promoter of Narcan should be everywhere there's a defibrillator. If you've got a defibrillator at work, there should also be Narcan. And I just came off of doing a training at a large church in an urban area. And every one of the pastors in the room said, we're not necessarily worried about the homeless population that we're housing. We're worried about the kids coming to youth group that we know are using substances. And they didn't have Narcan anywhere in their facilities. And
Yep.
then suddenly their hands went up of so many individuals carrying Narcan because they're concerned. And I'm like, let's fix this right now. Let's figure out how we can go to public health. We can bring Narcan in and you can have that, right? But again, it's just that whole idea of how do I do that in the workplace? Do I have to have a policy for that? How do we implement that? And those are things we have to struggle through and we have to do. We can't just ignore it. And we're
No.
still seeing
No.
it ignored at such a high rate
Right.
across the board.
And we'll see, and so we're going to talk about the data next, but we're going to see that there's damage to ignoring it. There's damage. And
Absolutely.
so it's like it's not just, damage to the individual, but to your work environment and your culture and everything else. And so you've got to address it. And so it's important to learn. And if you don't know, like Jason said, bring somebody in like Jason who can talk about it and help and get training on it so that you feel comfortable knowing what you need to know and make that policy so that everybody's on that same page. And I hadn't thought about that. We just did AED training because we had someone in our office that had heart issues, and it became top of mind to people that were just sort of afraid after that happened that, hey,
Mhm.
that could happen to anybody, which is true. But it took bringing it closer to home
Right.
before somebody thought about it. Well, we didn't do Narcon training. We don't have any policy on that. And so that may be another area that we need
Yep.
some help on at the office, right? I don't think that's even in our line of work. We probably really ought to
Hmm.
have that. So,
Yes.
all right. So move into the conversation about data. We always have really big numbers here, but who is struggling? What are the percentages? Talk to us about what the data says and what we're looking at here.
Well, in a lot of our presentations, we talk about substance use, the increased use over the past 4 years, and who's impacted. And we often end up saying all of us are the ones
Mm-hmm.
impacted by increased use. And so we think specifically about the most used drug, most frequently used, and that's alcohol. Over 11% of American adults had an alcohol use disorder in the last year. So that's a diagnosable disorder drinking happening in the last year. And so if we think about the use of substances and alcohol, how often does someone show up at work at 6 a.m. for that first shift and they were still out drinking at the bar at 2 a.m.? What is the likelihood that they're still impaired?
Oh, I know we talked about this on our previous podcast when we went to Pittsburgh for a football game and sat next to a guy who was going to work at 5 a.m. and
Yep,
we could tell we were out till almost midnight and we knew good and well he'd still be drunk tomorrow. We just knew.
absolutely. And he was going to be
He
driving the forklift because he told us he'd be driving the
he was
forklift.
going to be a mess. But he's just one guy, right? But how many people? It's probably a lot of people. And there's a lot of people struggling with substance use disorder. So how many people are struggling with substance use disorder this last year?
Just a little bit under the alcohol one, almost 10%, Renee. So I mean, I think, as we look at those percentages, some of them overlap, some of them
Yeah.
don't. It becomes, one or two people out of every 10 who actually is struggling. That's not even talking about those who are just binge using
Right.
or using
Right.
recreationally. And so you end up with a large chunk of your workforce who at
Right.
some point is engaging in substances that is
Yeah.
probably going to overflow into the workplace, at least to some extent.
Yeah. I always look at the data here that we've got in front of us on the social cost of alcohol and tobacco and
Yeah.
drug use. And the alcohol is responsible for 191.6 billion with a B
Hmm.
of the 510 billion, and tobacco use is responsible for 167 billion. And that's just so much. I mean, it's so much of a social cost. And what they talk about there when they roll in social cost, you're thinking about not just, physical health costs to the person, but absenteeism and presenteeism and churn from
Hmm.
losing workers and workforce, and just the cost of not being able to do business. And there's a lot of cost to doing business when you have folks that are on substances in your workplace. It's not just the issue of healthcare prices itself, even though that also goes up.
Well, I love the productivity stat. Of those employees who engage in alcohol or illicit drug use, they're 33% less productive, right?
That's
That's
right. Yeah.
costing their employer $7,000 on average annually. That's a huge hit to a small employer who needs 100% out of all their employees. That
Right.
means everyone else is having to do more, which impacts morale, which then you just have a domino effect across an organization culturally when you can't address these things and be rapidly responding all of the
Right.
time.
Yep. I also appreciate the one that says substance abuse costs America's employers more than 160 billion per year in accidents, lost
Yeah.
productivity, and related problems. Wow. And it says 65% of on-the-job accidents have to do with alcohol and drug abuse. And so if you've got those jobs, we talk about construction being a really high rate of suicide in that particular division. But those jobs, if you're coming in and you're not top of mind, we think of some of the most horrible accidents that you've seen on construction sites and challenges. They're if they're not sober, right? And so those are jobs that you've got to, you've signed all of the paperwork and all of those waivers saying you're not going to drink and drive. But these are the folks you're talking about that maybe they did too much the night before and they're still coming in the next day and they're still struggling and they're still, intoxicated 24 hours later and they don't, well, I wasn't drinking this morning or whatever, and so think it's okay. And there's a
Well,
lot of challenges in this space.
or just simply think about heavy equipment. I mean, I have horrible allergies. I'm running a combine all fall. A lot of the drugs I take for my allergies say I shouldn't be operating heavy equipment. It can impair my reaction times to certain things. I mean, so, we need to think about there are things that we do that are
Yeah.
actually bad that people do without even thinking about it sometimes.
Yeah.
But actually, if I'm tired, have too much caffeine, and I'm taking allergy medications, that trifecta is actually very dangerous when you're operating heavy equipment. And
Yeah.
so, I mean, so
Yeah.
we think about farmers, construction workers, and others who are operating huge equipment, running up against deadlines, have a lot of pressure on them. This can be very dangerous, right? So it really affects employers across the board, from small farms all the way through large corporations.
Right. So I wanted to talk about some different specific stories that people can think about. But when you have the employees with addictions, we talked about that at the top of the show, and they have protection from the federal government as they should for those seeking treatment. And this FMLA, which is your Family Medical Leave Act, is available to folks. So if you're in a small office and somebody takes FMLA, you continue to pay the salary of that person. And so you may have the salary of that person that you're still on the books paying for, and then what you said, a third of being less productive. But if they're physically not there because they're out for treatment, then it's 100% of their job gets deployed to other people. And so then those other people are doing, maybe you say you took that job and divvied it up among three, which I think is what happened in our office years ago when they had this issue. But one person then ended up with three, three different people took a third, and a third.
Mhm.
So each person's then doing their whole job plus a third of somebody else's. They don't get paid that additional dollars because the person on FMLA still has the funding. They still get paid because that's part of the protections of them getting help, is that they still get their income at whatever levels is agreed upon with their policies. Some are different, but they still are protected to keep the job. They may get paid, they may get all their pay, they may get partial. It depends on what your situation is, but it still doesn't just let you take the money from them and give it to everybody else. They're still using insurance benefits that are costing your company. I mean, and so which is all good things, right? We're helping a
Right.
person with addictions get help. That's good. But we don't think about what it did to everybody else that left behind and how long is that season going to be? And is the person going to get actually helped? We don't know, right? Are they going to be able to come back fully functional and then all that go back? And what is that kind of just the bitterness and the angst and the anger about having to have covered for this person and their lack of responsibility and it's just a lot. And so being me taking over an office had one of these situations in the past, there's just a lot that still and talk about. We just did vicarious trauma last week, right?
Mhm.
Trauma that came from this weird scenario. I don't even know all the people, the players. It was way before me, but people are impacted. So if you make different changes to their workloads or different changes to, you know, their performance evaluations and how much they get paid, man, that stuff that happened back when is still impacting today. If you know what I mean? So it's like, it's a bigger issue than just focusing on the person to get help. It impacts everybody. And that's just a
It's
small office. You do this at a bigger level. Wow. Lots of people are impaired.
it's also an opportunity to address the stigma, right?
Yeah.
Because a lot of times someone's a lot more patient with someone who's out on maternity leave, who's protected by FMLA, than they are for someone who's receiving treatment. And
True
so I
that.
think it's also important to acknowledge that the hope is for that person to find recovery. And coming off a National Recovery Month where we talked about recovery, I do think it's important to acknowledge that there is a perception and stigma that kind of clouds employees during this period of time as well. And so there does need to be some candid conversations in a lot of workforces about how do we support each other overall and give people the time and space that they need to come back. And so, I think that is something that we don't do enough of in workplaces.
No, I think of another time that we've been doing training and we talk about third shift or on call, right? We talk about this all the time. And when you're in a room of people that are with HR folks or with business owners and you say, how many of you know exactly who you're not going to call if an
Absolutely.
emergency happened at night, you already know who you're not calling. And the whole room can raise their hand, right? Because people that start drinking right at the end of the day of work. Now, they may not be impaired during work, but it still limits their on call. And I know you have that story you've told before on the podcast about your psychiatrist friend that was
I was
always,
just thinking about that,
I
but
know,
the
that's a good story.
psychiatrist I would have to call up, and
Exactly.
he was the wine connoisseur for the local newspaper, wrote the weekly wine tasting article, and he
Hmm.
would be inebriated every time I had to call him to get admit orders for a patient to the local psychiatric unit because it'd be Friday night and he was the only psychiatrist on call
Right.
who had admit privileges, and he was living his life no matter what,
Right.
whether because he had to work 24/7, 365, and he never got a break. In hindsight, as we talked about vicarious trauma and compassion fatigue, all of the things, it was all textbook.
Right.
And so I think that it is important to recognize that there are a lot of folks who are using on the job, and it's not always as noticeable as that situation, but that happens regularly all the time. And sometimes it's accepted. In that case, it was accepted. And right, wrong, or indifferent, those are the things we really have to uncover, talk about, and come up with backup plans and think
Right.
differently.
Well, and it goes back to what we were talking about earlier, this podcast about making policies that actually support this, right? So people that are on call, there needs to be actual when they're on call versus when they're not. And it can't be
Right.
that perpetual everyday on call situation like you just said. But the policies need to back that up. And then when they're off, they need to be able to enjoy life off. And this
Mhm.
blends into that whole concept of work-life balance and being off. And when you're off, and all of that. And so if you're expecting them to just stay sober all hours of the day, then they should really be paid for being working on all those
Mhm.
hours. And that's not the way things are working right now. So part of this, again, it's not necessarily stigma, but some of this is you're setting people up because if they know they're off at 4:30 or 5 and then they can live their life and do what they do, why are we calling them then after hours and being upset with them that they're inebriated or whatever? They were off. And so
And
part
you
of
don't have
that
to be
is acknowledging.
inebriated, right? Just to even have a drink with supper or a glass of
Exactly.
wine could be a violation in
Right.
some of these cases, and maybe not appropriate. And so just thinking basically.
Right. All right. So this week, the recovering politician self-care policy of the week, it is Thanksgiving, and it's time for me to double down with gratitude. I think I've told you all this before, but I have a gratitude app on my phone, right? Twice a day, write out 3 things I'm thankful for. And it just keeps me focused because research shows that you can't really be upset about the past or worried about the future when you're present in the now. And being grateful helps you kind of solidify what's going on right this minute that I can be grateful for today. And so last month, I actually passed 500 days in a row on my app. I've been doing this now for a really long time. And it's very helpful to me because it helps me just first thing in the morning, figure out what my day is today. And then again before bed, kind of reflecting on how my day went and just resets me day in, day out, day in, day out. So I don't have to worry about everything. So for me, it's just a really good opportunity to be grateful and to be focused on that. And then Thanksgiving, when's a better time to do that? So, Jason, do you have any thoughts on being grateful this Thanksgiving?
Well, I'm a curmudgeon farmer, so sometimes I'm not grateful for the grain prices or the futures market or all of those things. So I probably need to practice more on my gratitude and my gratefulness here since we're at Thanksgiving. So I'm gonna put this as I'm gonna work on it.
It's a work
Um,
on it category.
yeah.
Well, I know for me and I know for Jason, we're very grateful for all of our listeners and for the folks that join us week in and week out. I know our conversations are not the typical conversations out there on a podcast, and they really are focused on what's good about a behavioral health system and where we can improve. And that's not always easy conversations to have, but we're grateful for each of you that listen each week. If you ever have any feedback or anything that you want us to hear, clearly we listen to our YouTube channel. We'd love to have more comments over there. Feel free to tell us exactly how terrible we are. We enjoy all of that, but we are really grateful for you. But today we talked specifically about drugs in the workplace, and during the holiday season, that's when more people drink and drive. It's just a lot of challenges this holiday season. So just be aware in the workforce, you may see more of this during this holiday season because the holiday seasons aren't easy for everybody. There's a lot of stuff going on. So just make sure you're paying attention to that. We've given you some good resources in our show notes today. And if you need any other assistance, please let us know. We'd happy to help you. Have a great week, everybody. We'll talk to you soon.